people talk about their hearts, maybe their heartbeat. Sometimes you hear the phrase AFib. Now that stands for atrial fibrillation. It's the most common type of abnormal heart rhythm and the leading cause of a stroke. Now a local hospital is leading the way, though, in treating AFib, and it gave First Coast News' Katie Jeffries an exclusive look at how they're doing it. Pretty interesting.
In this operating room at St. Vincent's Healthcare, Dr. Anthony Magnano is readying a procedure called catheter ablation. The 59-year-old patient on the table had a problematic heartbeat for the last 30 years, but that is all about to change. Dr. Magnano is using these tiny catheters to go up through an artery in the leg into the patient's heart. From there, he uses ultrasound mapping to create a 3D image of the heart. And by using an ultrasound, it significantly reduces the amount of radiation a patient is exposed to.
So less radiation translates into less risk of cancer for patients over time.
In its simplest terms, to stop the electrical firings that put a heart into atrial fibrillation, Dr. Magnano creates a ring of scar tissue around the atria and conductive veins to act as a buffer, so the firings can't spread through the heart and cause it to suddenly beat rapidly. Those red dots that you're looking at on the 3D image are the spots of scar tissue he's created.
So many of these patients are able to come off of 2 or 3 different medicines that they were using to control their arrhythmia.
And the recovery time is minimal. This patient should be up and back to normal within a week.
But it looks great. So
Dr. Magnano says simply improving a patient's quality of life is what this is all about.
At the end of the procedure, his rhythm looks pretty good. He was in incessant arrhythmia at the beginning of the procedure, and now it's very hard to provoke any abnormal rhythms. So I think he should derive a benefit, and we look forward to following him in the clinic and seeing how he does.
In Jacksonville, Katie Jeffries, First Coast News, NBC 12, ABC 25.
The catheter ablation has a 75 to 80% success rate, pretty high. If you want to learn more about it, we have provided information on our website, of course, firstcoastnews.com.